It's 11 a.m. here in Seoul. I'm Oh Seong at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the country. In just a few moments now, we're going to cut into the briefing at the Sejong Government Complex with simultaneous interpretation available in English. We're going to go into the briefing room where Kim Gang-nip, overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing the latest figures and updates on the COVID-19 situation in the country. So that's just what we're going to do right now. We're going to go into the briefing room at Sejong Government Complex. They're setting it up right now, and in just moments' time, the overall coordinator, there you go, he's going up to the podium, and it looks like the briefing's just about to begin.
We also have sign language translation available. Here is Mr. Kim Gang-nip, overall coordinator 1 on the briefing. Let us now begin our regular briefing for April 1st, Wednesday. As of today midnight, we have a total of 4,155 people in quarantine. 5,567 have been discharged following full recovery, and the death toll stands at 165. We had 101 new patients from yesterday, and 159 more people were discharged, and 3 more people died. I send my deepest condolences to those who have passed away, as well as the bereaved families. Of the 101 newly confirmed cases, 65 were confirmed here in the nation, and among them, most of them were related to cluster infections at churches and hospitals. And we are still seeing cluster infections here across the country. And we had a total of 36 confirmed cases which were related to overseas imported cases, and 7 were related to the airport. And aside from the 3 foreigners, the rest of them were Korean nationals. This morning, Prime Minister Chung Se-kyun convened a KCC meeting this morning, during which he touched upon issues including strengthened screening measures for the inbound travelers. He also touched upon the issue of the absentee voting for these Korean nationals living abroad. And he said that as from midnight of today, we will have a mandatory 14-day self-quarantine for all inbound travelers, and he also urged the local municipalities to enhance their quarantine and screening and monitoring for those who are on self-quarantine. And he also urged all of the international travelers to abide by the mandatory 14-day self-quarantine for the sake of the safety of our community. Starting from the 22nd of March, the government has put in place the enhanced social distancing campaign. Still, we are witnessing cluster infections throughout the country, as well as an increasing level of inbound cases. And we believe that we need to transform and we need to go into the everyday life quarantine, and we need to make sure that our municipalities need to cooperate with the central government to enhance quarantine measures going forward. We believe that the effects of the enhanced social distancing campaign are bearing fruit, and we ask for the public to continue to practice such measures. We believe that all of the public, individual, every one of them are the agents and are actively participating in the social distancing campaign, and we thank you all for this. And after our campaign of enhanced social distancing until the weekend of this week, we are currently reviewing and monitoring measures for promoting everyday life quarantine guidelines for the public. We are opening our ears to the opinions of the experts, and we will unveil these guidelines to the citizens as soon as possible. Starting from midnight of today, we have been strengthening the screening for inbound travelers. The number of inbound travelers has amounted to about 80,000 from the first week of May, and this has decreased significantly to about 50,000 from as of last month. About 70% of them are Korean nationals, and if we look at the inbound travelers from the Europe and US, 90% of them are Korean nationals. Starting from today, all of the inbound travelers, regardless of where they are flying from and regardless of their nationality, they would be mandated for a 14-day self-quarantine. For short-term travelers who do not have a place of residence here in Korea, they will be transported to the designated facilities, and the living expenses will not be supported. And before they aboard the flights from these destinations, they will be notified of the fact that they need to go under self-quarantine of 2 weeks, and they have to download the self-diagnosis application. And most of all, we check their body temperature and screen whether they show any symptoms of fever. And once they arrive in the airport, they will be screened at 20 facilities, the walk-through facilities that are stationed there. And for these people who are subject to self-quarantine, we provide them with a self-quarantine notification. And for all of those who are under self-quarantine, once they arrive at their homes, local municipalities also give them another self-isolation notice. And persons who violate the self-quarantine regulations, they will be subject to imprisonment of up to 1 year or fine up to 10 million won. And we have provided 9 facilities that will be used as short-term travelers, and we will also secure more private hotels if we see a surge in the number of short-term travelers. And they will have to pay for their own expenses during their stay here in Korea. And as for those who are on self-quarantine, we will have designated people from the municipal governments to monitor them. And we also have the application which will be mandated for them to download. And as we have mentioned numerous times, we will abide by the principle of non-tolerance for those who fail to comply with self-quarantine measures. And the KCDC will cooperate closely with the local governments in order to curb the further spread of the inbound cases, and we will monitor all of their routes as they travel from the airport to their designated residences. And as for the opening schools of the reopening of the schools via online starting from April 9th, we also extend the opening of the daycare centers. And these will be monitored and these will be announced in a later date after monitoring the status quo of the increase in the number of patients here in Korea. And as for the emergency daycare centers, we will have them open available to parents who need to utilize these services. And the utilize of this emergency daycare center is also on the rise, and therefore we will enhance our quarantine measures for daycare centers. And they will be screened of their body temperature twice every day. And if they have symptoms, we will advise them to take a rest at their homes for the next 14 days. We will also disinfect these daycare centers, as well as carry carrying out regular ventilations. And also we extend the social welfare facilities in order to curb the further spread of the community. These facilities include those that are for the elderly people as well as children, and they have been also closed on a continuous basis from the end of February. And about 99.3% of the entire facilities across the nation are on closure right now. And even though they are closed, we are having required employees to work to come to these facilities for work, and we will make sure that if the parents cannot take care of their children at home, we will provide emergency caring services at these facilities. And especially for the special designated of the special disaster zones in Gyeongbuk and Daegu region, we will provide them with the necessary medical devices. And we believe that there could be some loopholes in the monitoring of the welfares, the health for these people, especially for the vulnerable class. We are continuing to witness increase of the patients here in Korea, and we believe that we cannot let our guards down as of yet, and practice continued enhanced social campaign of social distancing. Even though we are physically apart, we need to send words of support and comfort to each other, and we need to help each other out in this difficult times. Today is April 1st, and today is April Fool's Day, and right now, we are going through a very grave, serious situation here in Korea, and we cannot be tolerant of any fake telephone pranks. So we believe that you abide by such measures, but we advise you to give a telephone call to your parents or your family members and send words of support, and also support those who are on quarantine and who have been confirmed of the virus. And even though you cannot meet physically, we hope that you share words of support to each other. And just as you did, you've shown a great level of civil awareness, and we would like to thank you once again for this, and we hope that we can muster our strength further to participate in the enhanced social distancing campaign going forward. We also would like to extend our gratitude to all of the medical practitioners who are fighting on the front lines to combat the virus. And the government would like to spare no efforts to provide to the medical staff who are fighting on the front lines. And we ask all of our public to send words of support to all of these medical practitioners. Just as you did so far, we ask the public to cooperate closely with the quarantine authorities so that we can overcome the outbreak. Thank you very much.
That was a live briefing from South Korean health authorities you just heard. They're updating us on the COVID-19 situation here in Korea. We just heard that there were 101 additional confirmed cases, bringing the total to 9,887. There were also 3 more deaths, bringing the total to 165. Well, that concludes our coverage of this morning's briefing. We will be back with more updates in just a little while at 12 p.m. Korea time with our regular midday news. Bye for now.